Margaret was 78, a widow, and the kind of woman who never wanted to bother anyone. That night, she stood in her kitchen a little longer than usual, one hand resting on the counter, waiting for a strange pressure in her chest to pass. It was not sharp. It was not dramatic. It was just enough to make her stop and breathe differently. She told herself it was probably indigestion, maybe stress, maybe she had eaten too late. She felt slightly nauseated, a little tired, and there was a dull ache creeping into her shoulder. But she had felt odd before and gotten through it. So she rinsed her teacup, turned off the light, and went to bed thinking sleep would settle everything down. By morning, she was gone. And that is exactly why this conversation matters. Because one of the most dangerous things an older adult can do is lie down and try to sleep through symptoms that may already be pointing to a heart attack or a stroke. Not because sleep is harmful, not because the bed is dangerous, but because the body does not pause an emergency just because it is nighttime. And what makes this so tragic is that the signs are often quiet enough to sound harmless in the moment. I'm Dr. Marcus Evans, medical doctor and physician, and on this channel I try to explain health issues in a clear, calm, practical way, so you can better understand what may be happening inside your body before something small turns into something life-changing. And if that kind of information matters to you, subscribe and stay with me, because what we are talking about tonight could help you recognize danger before it is too late. Now let me be very clear. The mistake is not going to sleep because you are tired. The mistake is going to sleep when your body may already be sending distress signals. And you decide to explain them away because the timing feels inconvenient, the symptoms feel confusing, or the whole thing just does not seem serious enough to call for help. That happens more often than people realize. An older woman feels pressure in her chest but does not call because it is not crushing pain. A man feels short of breath and unusually weak, but assumes he is exhausted. Someone gets a strange headache, or feels a little off balance, or suddenly starts sweating and decides to sleep it off. Another person notices their heart feels irregular for a few minutes, then settles down, and they tell themselves they will mention it to the doctor next time. But that quiet decision, that one private choice to wait until morning, can be the moment everything changes. What makes this especially dangerous is that people often imagine heart attacks and strokes as loud, dramatic, unmistakable events. They expect collapse. They expect screaming pain. They expect a scene so obvious that nobody could miss it. But the body does not always work that way. Sometimes the warning arrives in a softer voice, a heaviness in the chest, a strange discomfort in the jaw, sudden nausea, an odd wave of fatigue that feels deeper than normal tiredness, a tingling arm, a sense that something is wrong even if you cannot explain why. And those are the moments people talk themselves out of action. They say, maybe I just need rest. Maybe I pulled something. Maybe it is acid reflux. Maybe it is anxiety. Maybe I will feel foolish if I call for help and it turns out to be nothing. That last one is more common than many families realize. Older adults, especially those who pride themselves on being strong, independent and low maintenance, often do not want to wake anyone up, cause alarm, or make a scene. They would rather be polite than urgent. They would rather endure discomfort than risk embarrassment. But the body does not care whether a symptom is socially inconvenient. If the heart is struggling to get enough blood through blocked arteries, or if part of the brain is beginning to lose blood flow, time starts to matter immediately, not later, not after a full night of sleep, not after you wake up and see whether the feeling is still there. Right then, that is what makes this so dangerous. The window in which treatment can do the most good is often the same window people spend denying what is happening. And here is where people get misled. They assume that if a symptom is mild, it cannot be serious. That is simply not true. Some of the deadliest cardiovascular emergencies begin with symptoms that are easy to minimize, especially in older adults, especially in women, especially in people with diabetes, high blood pressure, or a history of heart disease. Sometimes the body does not give you a dramatic alarm. Sometimes it gives you a whisper and waits to see if you listen. That whisper might be chest tightness that feels more like pressure than pain. It might be sudden breathlessness while getting ready for bed. It might be weakness that seems out of proportion to what you did that day. It might be lightheadedness, sweating, a racing heartbeat, discomfort in the back or shoulder, or a strange sense that the body is not behaving normally. These things are easy to dismiss precisely because they can look ordinary at first glance. But ordinary is not always safe. This is one of the hardest truths in medicine. People do not always lose their lives because they had no warning. Sometimes they lose their lives because the warning arrived in a form they did not recognize, at an hour when they did not want to deal with it. And once you understand that, the next question becomes even more important. Because nighttime is not just when people ignore symptoms more easily. In many cases, it is also when the body becomes more vulnerable in ways most people never think about. Night can give people a false sense of safety. The house is quiet, the lights are off, the body is supposed to be winding down. So when something feels wrong, many people assume the best thing to do is rest and wait for morning. But the truth is more unsettling than that. For some people, the hours before sleep, during sleep, and especially the early morning hours, can become a dangerous window for the heart, the brain, and the entire circulatory system. That is not because sleep itself causes a heart attack or stroke in some simple, direct way. The real issue is that the body does not remain static overnight. Important systems shift. Blood pressure changes, hormone patterns change, breathing patterns change, heart rhythm can change, and if someone is already carrying hidden cardiovascular risk, those changes can make a serious problem easier to trigger and harder to recognize in time. Let's start with blood pressure. Many people know high blood pressure is dangerous, but fewer understand that blood pressure follows a daily rhythm. In healthy patterns, it often dips somewhat during sleep and then begins to rise again as morning approaches. That early morning rise matters. The body begins preparing to wake up. Stress hormones such as cortisol and adrenaline start increasing. The heart begins working harder. Blood vessels are under changing pressure. Blood can also become slightly more prone to clotting in the morning hours. For a healthy person, the body usually manages this transition without trouble. But in someone with a narrowed artery, an unstable plaque, uncontrolled hypertension, or existing vascular disease, that transition can become exactly the kind of stress the system fails to tolerate. And this is where the danger grows quietly. If a plaque in a coronary artery becomes unstable and ruptures, the body may respond by forming a clot. That clot can block blood flow to part of the heart muscle. That is the beginning of a heart attack. If something similar happens in the blood supply to the brain, or if a clot travels and blocks a vessel there, the result can be a stroke. These events are not random in the way people often imagine. They are often the final result of processes that have been developing for years and are then pushed over the edge during a vulnerable moment. Night can also be risky because symptoms are easier to miss when the body is at rest. During the day, chest discomfort during walking, climbing stairs, or activity may stand out more clearly. But at night, symptoms can blur into tiredness, indigestion, anxiety, or a vague feeling of being unwell. A person may notice pressure in the chest, a little nausea, some unusual sweating, or shortness of breath and assume they just need to lie down. But lying down does not fix blocked blood flow. It only reduces the chances that someone else will notice the problem in time. Then there is breathing. This is especially important for people with sleep apnea, whether diagnosed or not. In sleep apnea, breathing repeatedly stops or becomes shallow during sleep, which causes oxygen levels to drop and stress responses to surge. Each pause can put strain on the heart, increase blood pressure, disturb rhythm, and worsen inflammation over time. Many people think of sleep apnea as loud snoring or daytime fatigue, but underneath that, it can be part of a much more serious cardiovascular picture. If someone already has high blood pressure, obesity, diabetes, atrial fibrillation, or heart disease, untreated sleep apnea can make nighttime far more dangerous than they realize. Heart rhythm is another piece people underestimate. Some individuals develop irregular heartbeats that become more noticeable at night, either because the body is quiet enough to feel them or because the autonomic nervous system is shifting in ways that affect the electrical rhythm of the heart. An irregular rhythm such as atrial fibrillation can increase the risk of blood clots forming in the heart. Those clots can then travel to the brain and cause a stroke. Sometimes the symptom is obvious, like pounding or fluttering in the chest. Other times it is much subtler, a strange weakness, dizziness, breathlessness, or a sense that the body is not coordinated in the usual way. And still, many people wait. That delay is one of the most dangerous parts of the whole story. Someone says, "Let me get some sleep and see how I feel in the morning." But cardiovascular emergencies do not freeze overnight. Heart muscle can continue losing oxygen. Brain tissue can continue losing blood supply. Damage that might have been reduced with faster treatment can become permanent by sunrise. Certain people are especially vulnerable here. Older adults, people with high blood pressure, people with diabetes, smokers, people who are overweight, people with high cholesterol, those with a family history of heart disease or stroke. Anyone who has already had a mini stroke, heart attack, or known circulation problems, and people who live alone face an even harsher reality, because there may be nobody nearby to notice worsening symptoms or call for help if the situation escalates during the night. Now, here is where many people get this wrong. They think danger must feel intense to be real, but some of the most dangerous symptoms are not dramatic at all. Chest pressure may feel more like heaviness than pain. Stroke symptoms may come and go briefly. Breathlessness may be blamed on anxiety. Sudden weakness may be mistaken for exhaustion. A severe headache may be written off as tension. Confusion may be subtle enough that the person experiencing it does not fully realize anything is wrong. That sounds small, but it is not, because when symptoms come wrapped in ordinary language, people make ordinary decisions. They lie down, they wait, they stay quiet. And that is exactly why the next part matters so much. Because the signs you should never sleep through are often the very ones people are most likely to explain away. This is the part one I want you to remember most. Because when people hear a story like this, they often ask the wrong question. They ask, what exactly did she do? What was the one fatal action? But the more important question is this: what signs did she have before she made the decision to go to bed? Because in many cases, the deadly mistake is not a single dramatic act. It is choosing sleep over action, while the body may already be showing signs of a heart attack or a stroke. And the hardest part is that these warning signs do not always look the way people expect. Let's begin with the heart. If you feel pressure, heaviness, squeezing, burning, or tightness in the chest before bed, do not assume it is harmless simply because it is not severe. A heart attack does not always begin with crushing pain. Some people describe it as a weight sitting on the chest. Others say it feels like fullness, discomfort, or a strange pressure that will not settle. It can come and go. It can feel mild. It can feel confusing. But if that sensation is new, unusual, or paired with other symptoms, it must be taken seriously. And those other symptoms matter. Pain or discomfort can spread beyond the chest. It may move into the jaw, neck, shoulder, arm, upper back, or even the stomach area. Some people feel nauseated. Some begin sweating for no clear reason. Some feel suddenly weak, shaky, or short of breath. Some people even begin to feel suddenly lightheaded. And some just have a powerful sense that something is wrong. That last one is more important than many people realize. The body sometimes signals distress before the mind fully organizes the pattern. Women, older adults, and people with diabetes are especially important here because their symptoms may be less classic. Instead of obvious chest pain, they may feel unusual fatigue, nausea, pressure in the back or shoulder, dizziness or breathlessness. That is one reason heart attacks are sometimes missed or delayed in these groups. The symptoms do not match the dramatic picture people carry in their heads, so they wait longer than they should. Now let's talk about stroke, because stroke warning signs are just as urgent and often even more likely to be brushed aside if they happen at night. If one side of the face suddenly feels weak, numb, or different, that matters. If one arm feels weak or clumsy, that matters. If speech becomes slurred, confused, or hard to get out, that matters. If vision suddenly changes, becomes blurred, or disappears in one eye, that matters. If there is a sudden severe headache, unlike your usual headaches, that matters. If there is abrupt confusion, poor balance, dizziness, or a strange inability to coordinate your movements, that matters. And here is the dangerous trap. Some stroke symptoms fade for a few minutes or seem to improve. People think that means the danger has passed. It may not have. A transient ischemic attack, often called a mini-stroke, can be a warning that a larger stroke may follow. So if symptoms come and go, that is not reassurance. That is still an emergency. Now here is where people get this wrong. They compare the symptom to their routine discomforts. They say, I have had indigestion before. I have had headaches before. I have been tired before. But the real question is not whether you have felt something similar in the distant past. The real question is whether this moment feels different, sudden, unusual, or out of proportion. A dangerous event may not announce itself with perfect textbook clarity. It may appear as a pattern of symptoms that feels slightly strange, slightly stronger, slightly more unsettling than normal. That is often enough to indicate a serious problem. So what should you do instead of going to bed? First, sit upright and stop what you are doing. Do not tell yourself you will sleep on it. Do not take comfort just because the symptom is mild. Second, call emergency services right away if you have chest pressure, shortness of breath, one-sided weakness, slurred speech, sudden severe headache, confusion, or a racing or irregular heartbeat with other concerning symptoms. Third, do not drive yourself. If you deteriorate on the road, you put yourself and others at risk, and you lose critical time that emergency responders could be using to help you. Fourth, tell someone nearby immediately if another person is in the home. Do not stay quiet to avoid causing concern. This is exactly the time to cause concern. Also note when the symptoms started, because that timing can matter enormously in stroke treatment and in emergency decision-making. If aspirin has previously been recommended to you by your physician for suspected heart symptoms, emergency services may guide you. But do not start improvising treatments on your own in a moment of panic. The most important action is getting urgent medical help fast. That is the real lesson here. The danger is not being tired at night. The danger is interpreting possible emergency symptoms as bedtime discomfort. It is treating pressure like indigestion, weakness like fatigue, confusion like stress, and breathlessness like something that can wait until morning. Sometimes people survive because they act quickly. Sometimes outcomes are far better because they call when they feel foolish, rather than waiting until they feel certain. And that brings us to the other side of this story. Because recognizing warning signs is critical, but reducing the chance of ever facing them in the first place matters too. Recognizing the warning signs is critical, but there is another side to this story that matters just as much. Many heart attacks and strokes do not come completely out of nowhere. They develop out of pressure that has been building quietly inside the body for years. The arteries narrow, blood pressure stays higher than it should, blood sugar remains poorly controlled, sleep quality declines, breathing becomes more disrupted at night. The heart works harder than people realize. And because none of that always causes pain right away, many people assume everything is fine until the body finally forces the issue. That is why prevention is not some vague wellness slogan. It is a practical form of protection. Start with blood pressure, because this is one of the most important risk factors in the entire conversation. High blood pressure damages the lining of blood vessels over time. It makes arteries stiffer. It increases the strain on the heart. It raises the risk of both heart attack and stroke, often without causing symptoms you can feel day to day. A person can have dangerously high readings and still say they feel normal. That is exactly why it is called a silent problem. If you are older, you should know your numbers. Not guess, not assume, know them. If your blood pressure has been running high and you have been putting off follow-up, you are not delaying paperwork. You may be delaying something far more serious. Medication also matters, and this is where many people make quiet mistakes. Some skip doses because they feel fine. Some double up after forgetting a pill. Some stop a medication because they read something alarming online. Some take medicines at irregular times and assume it will not matter. But when it comes to blood pressure, heart rhythm, diabetes, and clot prevention, consistency matters far more than many people understand. Your treatment plan should not be improvised in the kitchen at night when symptoms appear. It should be discussed calmly with your doctor in advance, when your mind is clear and your body is stable. Sleep apnea deserves more attention than it usually gets. People tend to think of it as snoring, poor sleep, or daytime fatigue. But the deeper issue is what repeated drops in oxygen and repeated stress surges do to the cardiovascular system. Sleep apnea can worsen blood pressure, strain the heart, increase inflammation, and raise the risk of rhythm problems and stroke. If you snore heavily, wake up gasping, feel exhausted during the day, or have been told you stop breathing in your sleep, that is not something to shrug off, especially not if you already have high blood pressure or heart concerns. Then there is the role of smoking, alcohol, late heavy meals, dehydration, and unmanaged diabetes. None of these guarantees a nighttime emergency on its own, but together they can create the kind of internal environment in which the body is less resilient and more easily pushed into danger. Smoking damages blood vessels and promotes clotting. Heavy alcohol use can disturb heart rhythm and blood pressure. Large, heavy meals late at night may blur symptoms and make chest discomfort easier to dismiss as simple indigestion. Dehydration can worsen how the body handles circulation stress. Poorly controlled diabetes damages blood vessels over time and can also make heart symptoms feel less typical. These are not abstract health concepts. They are pieces of a system, and when enough of those pieces are strained, the whole system becomes more vulnerable. There is also something deeply human that needs to be said plainly. Too many people stay quiet when they feel something is wrong. They do not want to scare their spouse. They do not want to wake their children. They do not want to appear dramatic. They do not want to be the person who overreacted. But when you hide symptoms to protect other people from worry, you may be trading a few minutes of discomfort for a much bigger crisis. If you live with someone, tell them. If you live alone and you feel something serious may be happening, call for help immediately. Silence is not strength in a medical emergency. So here is a simple before-bed safety check I want you to remember. Are you having chest pressure, heaviness, burning, or tightness that feels unusual? Are you suddenly short of breath in a way that does not make sense? Does one side of your face, arm, or body feel weak, numb, or clumsy? Is your speech off? Do you feel confused? Are you having a severe sudden headache that feels different from your usual headaches? Is your heart racing, pounding, or beating irregularly along with weakness, dizziness, or breathlessness? Do you feel suddenly sweaty, faint, or profoundly unwell for no clear reason? If the answer to any of those questions is yes, do not negotiate with the symptom. Do not tuck yourself into bed and hope the body sorts it out by morning. Treat the situation with the seriousness it may deserve and get emergency help. That is the message I want to leave you with. Many people think the greatest danger is a dramatic collapse with no warning at all. Sometimes that happens, But often the danger arrives in a quieter form, a symptom that seems manageable, a strange feeling at an inconvenient hour, a private moment when someone decides to wait instead of act. That decision can change a family forever. Listen to your body, respect unusual symptoms, know your risks, and never assume that nighttime makes something less urgent. Sometimes it makes urgency easier to miss. If this helped you understand the danger more clearly, subscribe and share this with someone older, someone living alone, or someone with high blood pressure, diabetes, sleep apnea, or heart concerns. One conversation at the right moment can make more difference than most people realize. Share and subscribe.